Hello everyone, welcome you all with the Nursing Research Lecture Series. Today we are going to come across with the second part of the nursing research. With the last day, we are discuss about the research approach. Now we move to the second section, quantitative methods, qualitative methods, and mixed methods. In first part, we are going to talk about the quantitative method. The quantitative method is used when the researcher wants to collect data in form of numbers. This method is commonly used to measure levels, scores, frequencies, percentages, relationships, differences, and efforts. In nursing, quantitative research is common because many nursing problems can be measured numerically. For an example, knowledge score of nurses, pain score of patients, stress level of nurses, likewise. Quantitative method involves the systematic collection of numerical data. Data are usually collected using structured tools such as questionnaires, scales, tests, or checklists. The study is often conducted under controlled conditions to reduce bias. This means the researcher tries to keep the data collection process consistent for all participants. The data collected after the collection of the data needed to be analyzed using statistical methods. These may include percentages, means, standard deviations, chi-square test, t-test, ANOVA, or correlation. The findings are usually more objective and measurable. When we are considering with an example, a researcher may assess knowledge regarding infection prevention among nurses using a structured questionnaire. Each correct answer may get a 1 mark and the total score becomes numerical number. Then the researcher can calculate mean knowledge score and categorize knowledge as poor, moderate, or good. Now we move to the third section, qualitative method. Qualitative method is used when the researcher wants to understand experiences, feelings, meanings, beliefs, opinions, or perceptions. This method is not mainly about numbers, it is about understanding human experience deeply. In nursing, qualitative research is very valuable because nursing is a human centered profession. Nurses care of people, not only diseases. Therefore, patients' experiences, emotions, cultural beliefs, fears, and expectations are important. For an example, if we want to understand how mothers experience having a premature baby in neonatal intensive care unit, a qualitative method is suitable. Qualitative method involves the systematic collection of subjective information. Subjective information means information based on personal experiences, feelings, opinions, and meanings. Data are usually collected using interviews, observations, focus group discussions, or open ended questions. The study is conducted under minimum control because the researcher wants to understand real life experiences naturally. The collected data are analyzed using themes, meanings, and interpretations. Nursing, when we are considering, a researcher may interview nurses working in an emergency department to understand their experiences during overcrowding. From the interviews, themes may emerge such as emotional exhaustion, difficulty prioritizing the care, communication challenges, and fear of patient deterioration. You can see in here the brief comparison between the qualitative research and quantitative research. Next, we are move with the mixed methods. Mixed methods research combines both qualitative and quantitative methods in one study. This means the researcher collects both numerical data and subjective information. Mixed methods are useful when the researcher wants both measurements and deep explanation. In nursing, many research problems are complex. Numbers alone may not explain the whole problem. At the same time, experiences alone may not show the size or extent of the problem. Therefore, combining both problems gives stronger evidence. Mixed methods involves the systematic collection of both numerical information and subjective information. The quantitative part is analyzed using statistics. The qualitative part is analyzed using themes and interpretations. This provides a more complete understanding of the research problem from multiple perspectives. Suppose we study clinical preparedness among nursing students. For the qualitative part, we can use a clinical preparedness scale to measure nursing students' preparedness scores. For the qualitative part, we can interview students and lecturers to understand why students feel prepared or unprepared for clinical practice. When both findings are combined, we can understand not only the level of preparedness but also the reasons behind it. And finally, you all are getting much more knowledge about the inductive, deductive, and mixed methods approach with identifying the qualitative, quantitative, and mixed methods. Before ending, remember these simple ideas. Research measures, quantitative research quantitative research measures, qualitative research explores, mixed methods research combines measuring and exploring. In nursing research, choosing the correct method depends on the research section. Therefore, before selecting a method, always ask, what do I really want to find out? Thank you so much for joining with this lecture. I would like to kindly invite to stay connected with future lectures.